Hi, I'm Bob Schrupp, physical therapist,
Brad Heineck, physical
and
therapist.
together we are the most famous physical therapists on the internet.
Well, in our opinion, of course,
All
Bob.
right, Brad, if you're having chondromalacia or patellofemoral syndrome, which basically is pain on the front of the knee,
Right.
a lot of times it's around the kneecap. I'm going to go through all the symptoms here. You might have a little bit of crunchy noise, or as you said, Rice Krispie noise when you bend or straighten the knee. It hurts a lot of times when you bend or straighten the knee. Bad on stairs.
Right, especially going downstairs.
Especially going downstairs. Worse, generally more common in women than men.
Sure.
So it's just basically what we're talking about is a softening underneath the kneecap, and that's giving you some pain. In the last video, and I'm going to put that up right here, Brad, it kind of shows you the simple test you can determine whether or not you have it.
Right.
At least one of the tests you could try. And if it is true, then you're going to try this simple treatment. Now, there's a lot of treatments you can do for this. You can do stretching and strengthening, and I recommend you go ahead and do all those too. But you really should do this one first, and it's really based on the Mcconnell Taping technique.
Right.
And I'm gonna, I know the purists out there, the ones that do a lot of Mcconnell taping. There is a lot of different things you might do to the kneecap. There might be a tilt or it might be turned. But in most cases, this simple taping will do it.
Right.
So you might try this yourself. If it works, great. If it doesn't, take it off.
Yeah.
And if it doesn't work, you probably want to seek out a therapist that is trained in that Mcconnell technique.
Sure. So what are they going to do at home now? Get the knee
Very
out?
simple. You need a knee.
Yep.
You gotta have a knee that's hurting.
The painful knee going downstairs, it hurts.
So basically, the kneecap, generally, what the problem is it was riding too far over to the outside of the leg. Okay? There we go. It's too far over that way. So we're going to push it that way, toward the other knee. So if it's this one, it would be pushing toward this knee.
Right. Always to the inside.
Always to the inside. There you go. So now, if you're doing this taping for good and you want to leave it on for a full day, a lot of people are allergic to tape.
Right.
So do you want to give me the hypoallergenic tape?
Sure. Very good.
Oh, good. You want to buy some hypoallergenic tape, or I think it's called Coverall. If you type that into the internet or on Amazon, you can buy a roll of it, and it comes usually like with a little paper protection over the top of it, and
it breathes a little bit. Otherwise, if you are allergic to adhesives and that adhesives makes your skin broke out, I had that happen on a patient. I forgot to ask her. I taped her, and the next day she had a severe rash.
I've had people that I've even used this on, and they kept it on too long. They kept it on for a couple days, even though I told them not to. Yeah. And you're exactly right, severe rash. Yeah. I mean, because we're really tugging on that knee. So, but this one just needs to go down. You really, sometimes I actually pull over with this one too, but just put it over the top, going right over the top of the knee.
The kneecap.
Kneecap. Yep. And pull it over to the side there.
Pulling that way.
Yep. Okay. Now this is the one that does the work, and this is a heavy tape. One brand that I saw on the internet is called Leukosport, Leukosport. I'll put it down below too.
Sure.
And you're just going to cut off a piece here. Usually I cut off a couple pieces, Brad, because I'll show you in a minute why. But you're going to put this tape right on the edge of the kneecap. Do you want to show on the kneecap that one, Brad? Just so.
Right here?
Yeah, pull that one off.
Oh, I see.
Oh. So here's the kneecap. Be like this, and I'm putting it right on the edge of the kneecap, like as Brad said, through this, there's skin on top of there, obviously, and it's going to pull it over like that.
It puts that kneecap back in the groove where it belongs.
Yep.
For whatever reason is out of the alignment when you bend the knee out of that groove in the.
So I'm on the edge here, and now I'm going to push the kneecap over, and you got to see it actually move over. You'll feel it move over. So your leg's got to be completely relaxed. If you tighten up your quadricep or tighten up your knee, it won't move. And this may be tough on a lot of people, Brad. I see a lot of people have a tough time trying to move their own kneecap. Yeah. It kind of gives them the squeak. They get squeamish about it. Yep. So you push the kneecap over, and then you pull like this, and that holds it in place. Now I would then cut another piece of tape and do the exact same thing again. Push it over and tape it in place. Now based on the last video, if you watched it, you'll find out that the knee feels better immediately. Like if you were having pain going up and down stairs, now when you go up and down stairs, the pain is less. Right. So this is something you should know right away if it's helping. I think this is a critical part of treating this type of problem. If you try just to do strengthening and stretching, it's really difficult to make headway on this.
Right.
This seems like this really makes a difference. Now, so how long are you gonna keep the tape on? Since you're taping it yourself, I would go ahead and keep it on, just, do a day at a time. Take it off every evening before you go to bed, and then redo it in the morning again. And you wanna look at the skin and make sure that, keep the skin clean, because if you don't get all that adhesive off,
Right.
it's gonna, again, start to build up, and maybe your skin's gonna break down or react to it. So,
Okay, so we're gonna do this every day, and you're gonna continue to feel less symptoms, if you continue to do it.
Right.
And if the knee's feeling better, eventually you stop doing that.
exactly. Usually what I find out with a lot of people is it seems like it kind of stretches it out, Brad, and eventually stays in place. I think the other thing that happens is the quadricep starts working like it's supposed to do, and pulling it in the groove like it's supposed to.
And we're
So,
gonna have a video on some exercises to help that.
Are we gonna do a video on that?
You better believe it.
Oh, we are
Bob.
gonna do some exercises too. All right, thanks a lot.